Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. There are some conditions called neglected tropical diseases or NTDs. These are a diverse group of diseases caused by different pathogens, what we commonly call germs, including viruses, bacteria, parasites, and fungi. Sometimes they are caused by toxins. According to the World Health Organization, NTDs affect more than 1 billion people, but those who need preventive or curative intervention against them are up to 1.6 billion. As the name suggests, these conditions are found among tropical populations, although some have a considerably wider distribution. My guest is Executive Director, Uniting to Combat NTDs, and former Vice President of the Gambia. Dr. Isatou Touray is currently co-chair of the African Women Leadership Network. Dr. Touray joins us virtually from the Gambia. You're welcome to the show, Dr. Touray. Let me first ask you, why are these diseases called neglected? If you can hear me, Dr. Touray, perhaps you need to unmute. Perhaps you need to unmute yourself.
I have unmuted.
All right then. Can you tell us
Yes,
why these diseases are called neglected?
Thank you very much for inviting me to this important interview. Neglected tropical diseases, or NTDs, are a group of 21 diseases and infections that can cause significant disfigurement, disability, and death. They are primarily found in warmer climates where people often lack access to adequate sanitation, clean water, and basic health care. And they are called neglected diseases because there is very little attention given to them by the healthcare system. If they do, is on the last list of their priorities, and therefore there is need to pay attention to them. And that negligence that is given to them is the reason why the disease is very difficult to be given the attention it requires.
Okay, can you tell us how these NTDs impact communities in Africa, especially in terms of health, education, and economic development?
NTDs often force families and entire communities into a cycle of persistent hardship, as those who fall ill may be unable to work or attend schools, and family members must shift their focus to caregiving. This not only disrupts household routines and long-term plans, but also diminishes overall community productivity. Stigma and social isolation can compound these problems, further straining affected families and reducing opportunities for employment or education. In many areas, NTDs also contribute to significant financial burden, such as cost of reducing opportunities, such as cost of repeated medical appointments, travel to distant health facilities, and other expenses related to ongoing care. Children who miss school are often unable to fulfill themselves. They are unable to actualize to become adults to benefit themselves and their family, and that
Okay,
has a very serious impact.
Dr. Touray, I'm hearing that, because of disabilities, they
Mm-hmm.
lose a lot of opportunities. They don't have access to
Yes.
health. And then
Mm-hmm.
because of that, some of their able-bodied members also have to cut
Mm-hmm.
school and work to take care of them.
Absolutely.
That indeed is a
Absolutely.
great impact. But let's zero in
Yes.
now on river blindness, what is
Yes.
officially called onchocerciasis. Can you tell
That's
us
it.
what
Yes.
it is and why is it
Yes,
such a
indeed. Mhm.
concern in Nigeria?
Yes. River blindness is also called onchocerciasis. It's an eye and skin disease caused by a tiny worm that's usually passed to humans through the bites of black flies. These black flies breed near fast flowing rivers and streams, which is why the disease is commonly called river blindness. When the baby worms microfilariasis move around under the skin, and eventually die, they cause severe itching, skin rashes, and even lumps or nodules under the skin. Over time, they can also affect the eyes, sometimes leading to vision problems or permanent blindness. In Nigeria, the disease is a significant concern because so many people live in areas where these black flies are common. While 7 million people are affected by this disease, 40 million are at risk of being infected with the Onchocerca volvulus, the parasite responsible for the disease. Severe itching and visual impairment can prevent children from going to school and adults from working, keeping families trapped in poverty. In some cases, children who are infected at a young age may also experience epilepsy from scientific research.
Wow.
Also, all of this makes river blindness more than just a health issue. It holds back economic development and disrupts community life. By reducing exposure to the to the black fly bites and providing regular treatment to affected communities, we can protect people from these serious impacts and help
Let me
communities
quickly cut
thrive.
in, Dr. Touray. Let me cut in briefly.
Yes.
Um, I had the impression some time ago, correct me if I'm wrong,
Mhm.
that it
Yes.
was becoming a thing of the past in Nigeria. Was there a time that the numbers went down and then came up again? Because I was a bit taken aback to hear that it's still such a problem
Yes.
in the country.
It is still a problem, but because it's a neglected tropical disease, it doesn't capture the attention of the public figures. You can imagine 7 million people affected, and this is based on statistics that have been derived, and 40 million are at risk. So it is important to pay attention and focus on the disease so that what is going on can be reported. And once it is put within the framework of the healthcare system where it is integrated, then it doesn't become a neglected issue. That is the reason why we call it neglected tropical diseases, and also to make a spotlight on the importance of this that can really have some deleterious impact on lives and livelihoods and the country's economic development.
What does treatment look like when it is treated?
Well, yes, it can be prevented. Prevention relies
Oh,
heavily on controlling black fly populations and reducing people's exposure to the bites. This can improve spraying insecticides around rivers where the flies breed, distributing insecticide-treated nets, and encouraging individuals to wear protective clothing. Treatment usually involves a drug called ivermectin, which kills the microfilaria, and helps stop transmission. In many communities, health workers and volunteers conduct regular mass drug administration campaigns to ensure that everyone in high risk areas receive treatment. By combining these measures, entire regions can be protected, leading to fewer infections and ultimately the elimination of the river blindness. It is treatable, it can be prevented, but it is the attention that is not given to the diseases. That is the reason why we are still suffering from it.
okay. You mentioned the preventions, and
Yes.
that got me thinking. If a person should um, observe the normal preventions against
Mhm.
malaria, then it will be
Mhm.
a significant prevention against onchocerciasis. Mosquito treated
Well,
nets?
mhm, that's
Yeah.
true. There needs to be an integrated approach to it, because what is happening is about awareness, is about being conscious of what is happening and recognizing the existence of these diseases that we are living with. Prevention can also be enhanced by integrating NTD programs with water sanitation and hygiene, wash interventions, improving wash services in rural and deprived communities, contributes to reducing prevalence of the disease as it reduces the need for
Can
vulnerable
you,
communities to access
sorry
unhealthy
to butt
water
in, doctor.
sources.
Sorry to butt in.
Mhm.
Can you explain what wash intervention means? What's a wash
Okay,
intervention?
wash intervention means creating awareness about the need for people to wash their hands, to observe hygiene, and to ensure that whatever they are doing, they are protecting themselves by using soap and water to wash themselves. These are very simple
Very
precautionary measures
simple.
that can be done to prevent disease. And I think with the support, encouragement, and the awareness and advocacy around that, I think communities can actually improve their wash intervention. Ministries of health do it because there was need to wash. It protects you from having what you call worm infestation, germs, and other forms of diseases that are transmitted through the hands, through the other things that we do using our hands and externally. That's very
Okay,
important.
so
So when we have
let me also, add a
Mhm,
question to that.
mhm,
I heard you
mhm,
mention ivermectin as a mode of
mhm.
treatment.
Yes, yes.
Ivermectin, as far as I know,
Mhm,
is a very
mhm.
cheap drug. Very
Exactly.
cheap. And
Yes,
why should it then be a problem? And then add to that, can ivermectin be used as preventative? Ivermectin only became expensive during COVID, but generally it's a
yes.
cheap drug.
In fact, in some communities, it is given free. It is even given free. So because the issues are there, the diseases are neglected. So even there's a lot of ivermectin that is given out to treat those diseases, and the need is that these health sector should take an integrated approach to that because it's about drugs. It's not about the ordinary person. Where our role here is to do advocacy, to raise funds, and to make sure that the ivermectin is available through the through the pharmacy support that they give. But also the health sector has to make it available, and if it is available, they have to educate the people. In most of the time, it is given free. So that should be that's a very effective medicine that needs to be used. And ultimately, the elimination of river blindness will come when people use this thing actively and make use of what is available to them, integrated into the healthcare system from a holistic point of view. But if there are silos in attending, like malaria, like COVID, like maternal child health, why don't you what we are advocating is to have an integrated approach within the primary healthcare system, so that all the information that this patient needs might be relevant and might be relevant will be heard, and then they can make the right decision and choices, and then that will move them to act and go after these diseases. Because you must understand that some neglected tropical diseases are interpreted from a very cultural perspective. Some don't
Okay.
believe that it's a disease that is caused by a particular vector or some other forms of this, but they think there is something that is diabolical. Like when you
Ah,
think about filariasis, you think about other things. They will tell you, you see my leg, how it is like. My enemies are after me, and I don't know what I have done. So their traditional understanding of disease phenomenon is also impacting on the number of people going out. And what we need to do in the healthcare system and out there at the community level, at the primary healthcare system, where you have access to these people who are affected, to be able to address them holistically. When you talk about malaria and the Anopheles mosquito, what are some of the things that are there? They advise them. Maternal and childhood immunization programs, what is there that needs to be done? The children have to be immunized against certain diseases, pertussis, and so many other things, so that when they grow, they will not be affected. So also, these NTDs like river blindness or onchocerciasis, filariasis, and all these snake bites, and at the same time also what you call worms, because most of the time you have our children from the age of 0 to this thing, they are infested with worms, even up to adolescents. So all these things are awareness creation, so that they know, and then they can get the right treatment.
all right. We're going to take a short break, but I have lots of
Yes,
things to ask you when we come back from the break.
absolutely.
Please stay with us. Welcome back. This is Health Matters on Channels Television. We're talking about NTDs, neglected tropical diseases, and zeroing in on river blindness. If you have questions on the topic, call 0808 054 2233. You can also send a message on X at CTV_Mary A. Dr. Touray, you mentioned protective clothing. Can you describe for us what protective clothing will look like?
Yes, when, for example, let me give you the example of malaria. You have the black fly also around the river banks, and you have also the mosquitoes flying also around the river banks and in other endemic areas. What happens is that if you put on the right clothing that covers your hands, your neck, your legs, and so on, that it will protect you to a great extent, because the flies focus on certain areas of the body, and once they are exposed, that means the likelihood of you having the disease where for them to bite you is there. You understand? So these are things. The protective clothes depends on what type of dress you are sewing, if it is a full dress gown or so, or what you can wear, and also depending on the number of flies that the area and its endemicity, and how
Okay.
this impact, how much they come out. So people have to wear something to protect them, and I think it could be anything that could actually make the flies not have access to your skin, because when it bites, it's the skin that it bites, and then these things occur and so on. So
Okay.
that's what I mean.
Um, we've been talking about children. Is this
Yes,
disease for children only? It doesn't affect adults?
it affects adults and children. It affects adults and children. In most cases, who goes to the river, or who are the people who are exposed to those areas, is children, women,
And women.
and men. Yes,
Okay.
women who are sometimes going to the rivers to wash the clothes of the family. It has a gender dimension. You have the adolescent girl, sometimes it's not going to school, who goes out to do some washing at the riverside, or goes to fetch water to feed the family, or to bring water for people to utilize, and so on. So I think it touches on everybody, and everybody's concern should be taken on board.
So I'm wondering, with this new policy that the United
Hmm.
States has of
Hmm.
withdrawing funding, health funding,
Hmm.
is
Hmm.
attention to NTDs going to be affected?
Well, here we recently heard about the freeze on U.S. foreign and funding and potential budget cuts affecting programs run by USAID and other entities. There is certainly a lot of uncertainty right now when it comes to future funding for NTDs from donors in the global north, including the United States. While it's still a rapidly evolving situation, and we don't know exactly what the long term implications might be, one thing is crystal clear: African leaders must act with urgency and redouble their efforts to fight NTDs. This is a moment to strengthen our resolve, not ease off. We need to cement African leadership by integrating NTD efforts into our health agendas, exploring innovative strategies to fight these diseases, and creating new funding mechanisms that are less vulnerable to fluctuations in external support. African leaders can demonstrate commitment to meeting NTD elimination targets by allocating more of their domestic resources towards financing ongoing NTD intervention programs. There is a lot of gains that have been made already. This should address financing challenges and gaps stemming from declining overseas development assistance from the global north donors.
Okay,
We cannot
so
afford to let our progress. Mhm.
you've
Yes,
told us
please.
that there have been some gains, a lot of gains.
Mhm.
Can you tell us
A lot
about
of
some of
gains.
these gains?
Yes, first, it is crucial that African leaders continue to prioritize NTDs in national health strategies and budgets so that robust funding and policies will be in place. This means that only allocating resources towards entities control programs can help. Now, what have we gained? 24 Africa over the last few years, Africa has made truly remarkable progress in combating NTDs, driven by ambitious leadership and strong regional collaboration. In fact, 24 African countries have now eliminated at least one NTD, underscoring that political commitment and community level intervention, which can push these diseases back. Togo, for instance, became the first country in the world to eliminate four NTDs, while Benin and Ghana have each eliminated three, and Malawi, Cote d'Ivoire, and Uganda have successfully eliminated two. In addition, Niger recently became the first country in Africa to eliminate river blindness, yet another milestone showing what's possible when leaders, health workers, and communities unite around a common goal. These achievements don't just benefit individual countries, they also contribute significantly to global NTD elimination targets set by the World Health Organization, putting us on a promising path to reach the 2030 roadmap goals. Here in Nigeria, for example, we have also seen notable advances that reflect this continent-wide momentum. Mass drug administration programs targeting river blindness, lymphatic filariasis, and intestinal worms have reached millions of people in high-risk areas. The government agencies, international donors, and local communities are working in partnership to expand the health services, improve access to treatment, and deliver health education. While we still face challenges such as reaching remote communities and securing enough resources. I think these collective efforts show that with strong political will, adequate funding, and community driven opportunities, the fight against NTDs can be won. Across Africa, it is the leadership of our policymakers, health professionals, and local leaders that continue to drive this progress, bringing us one step closer to eliminating NTD challenges. So Africa is not sitting down. We have been benefiting from the support that we gain from our partners from the global north, but now resource mobilization should focus on home-driven initiatives within an integrated approach to move Africa forward. In
Okay,
November
so
last year,
Dr. Touray,
the
we're
United
almost out of time, but I want to quickly ask you.
Mhm,
The word tropical in the name
mhm,
NTDs, is it
mhm.
because the black flies and all those other diseases are peculiar to this area, maybe global south, or is it because
Yeah.
the global north has eliminated those things and we're the ones left behind?
Well, what is happening is that these are things. Africa is an endemic area. We have the rivers flowing. We have a lot of the ecosystem in which we live. Also help facilitate the breeding of these things, and the fact that we are not different from the global north. They might have had these type of diseases long time ago, and those are eliminated. So it's no longer an issue. So you can see the improvement in their statistics and in their demographics. In Africa, it is affecting us, and we have to face it and tackle it head on. So support coming from the global north is just to help facilitate the work, but at the end of the day, we have to take leadership in addressing the crisis of these diseases within our countries. NTDs happen to be one of the neglected tropical diseases, and as a result, we need to throw a spotlight on them. We need to talk about them. We need to encourage our leaders to take leadership on them. We need to encourage the ministries of health. We need to encourage the ministry of finances, because what is happening, if there is less resources focused on them, we may not be able to treat them. And you have seen, as you have asked a very critical question right now, what is happening with the current situation? Support that was coming has already been suspended. We don't know whether it's going to come or not, but we cannot just rely on that. We need to do something, and the leaders have to take on responsibility and look at domestic financing, look at how they prioritize and integrate it within the
Okay,
healthcare
Dr.
ecosystem.
Touray, on
Mhm.
that note, Executive Director, Uniting to Combat NTDs, and former Vice President of the Gambia, co-chair of African Women Leadership Network. It's been so wonderful having you on the program. Thank you so much for coming.
Thank you for giving me the opportunity. Thank you.
And thank you, viewers, for being there with us. Have a wonderful day. I am Mary Alale Yusuf.